My name is Justin Thomas, and I'm a neurosurgeon at McLaren Northern Michigan. A neurosurgeon is a surgical specialist of the brain and spinal cord and also peripheral nerve. We particularly handle the surgical management of diseases of the central nervous system and peripheral nervous system. We also manage some of the medical conditions that are associated with the brain and spinal cord, but our principal job is to offer surgical treatments for the brain and spinal cord. The training that I received in Southeast Michigan at Ascension Providence Park Hospital, which is part of the Michigan State University College of Human Medicine, really specialized in training the surgeon to become comprehensive at all of general neurosurgery. In addition to some of the things that we learn in general neurosurgery, my program was particularly strong at training surgeons to become very competent at minimally invasive spine surgery. And instead of offering perhaps a traditional surgery where we go often through the midline, we're able to use minimally invasive techniques through small tubes that address the pathology or the problem. These approaches can be anything down a tube that is as small as 16 millimeters or about the size of a pinky, all the way up to about 26 millimeters in a tube, and just a little larger than an inch. And we're able to treat these pathologies from the side and from an angle, rather than have to go through a traditional midline approach. It decreases on blood loss, it decreases significantly on infection rates, and it also helps address certain problems without such a large surgery that otherwise would be a very big surgery. Before I started here, I wanted to improve our technology and improve the infrastructure from a technological standpoint for the neurosciences department. So what we did at first was we wanted to improve our visualization in surgery. And the way we did this was that we have a new operating microscope that allows us to enhance our abilities in surgery to visualize pathology. From a brain standpoint, we're able to also add certain filters and administer certain medications prior to and during surgery that allow us to visualize tumors in a very unique way that had not been done before here. The second thing we wanted to do was improve our ability to intraoperatively visualize the spine and also navigate around the spine when we're working in surgery. So we have some new technology that is being delivered by Stryker called an Aero. It's an intraoperative CAT scanner, high resolution diagnostic quality CAT scanner that allows us to intraoperatively visualize the spine, scan the spine at low doses of radiation, and also allow us to intraoperatively scan the brain. And we're able to get diagnostic quality CAT scan imaging of the brain while we're doing our brain surgery. This allows us to improve our ability to resect tumors. It increases our ability to navigate and also scan the patient at the end of surgery to make sure that we're satisfied with our hardware placement. And at the end of the day, it increases our ability to offer patients safer surgery with more predictable outcomes after surgery. I'm originally raised from Southeast Michigan and spent my whole life pretty much in Michigan. I am very enthusiastic about supporting Michigan, and I identified a long time ago that our community in the north part of the state really needs more healthcare providers. And so for me, I just wanted to be able to offer the community, a very large community when you look at the size of it, someone where I'm available and able to offer the community good surgical care. I also love the four seasons in the north. For me, I'm enthusiastic in the summer of cycling, running, boating, being on the water, and then in the winter, I'm an enthusiastic downhill skier, so you'll definitely see me on ski slopes. My ultimate goal for every patient in the community is for them to receive good, reliable, and safe care for both their brain or spine pathologies.